My experience in this field is that it is populated with a number of people who are very passionate about helping patients. And they believe that their systems and what they do or their methods or clinics are powerful. For many of them, it's because they got sober themselves in that manner. What's lacking from my experience in the past is hard data that shows how effective their treatment really is. To address that, for myself and for families and insurance companies and anybody that wants to see, how good is Symetria really at what they do, we went out and we purchased every commercial claim for every patient suffering from opiate use disorder in the United States for 5 years. We then analyzed that, pulling out our patients and then measuring all of the patients against measures that we could look at, and that would be emergency room visits, hospitalization, hospital readmissions, opiate prescriptions despite being in treatment, levels of buprenorphine or other drugs that they're taking. And then we also went and looked at all of these types of metrics to be able to see how good are we really against all the other treatment centers in the country. There were 1.5 billion claims that we analyzed across 3 million patients. And we had an outside firm of medical informatics experts do this work for us. What was revealed was between 40 and 83% reduction on every measure. The patients that we saw that came through the Symetria Recovery programs got better and stayed better. The measurements that we've talked about earlier, opiate use disorder, opiate use, hospitalizations, hospital emergency rooms, hospital readmissions, all of those measures were improved and they stayed down. So what this will allow you and your family to do is to know that by coming to the Symetria Recovery Clinic near you, you will be getting the most effective treatment you can possibly find for you, your loved ones, your family. And that's powerful. We put our money where our mouth is, and feel free to ask about what this data shows and see for yourself.